Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome back Harry Severance. He's an emergency physician, and today's Kevin MD article is Leaders Advise Us to Accept It as a Job Norm, Violence and Abuse in the Healthcare Workplace. Harry, welcome back to the show.
Thank you. Glad to be here.
So you were on last summer talking about violence against healthcare workers, and you wrote about it again in your most recent Kevin MD article. So let's jump straight into that article and tell us what it's about.
This article, as you noted, is a follow-up to my earlier work. It's an area where I concentrate in my work with multiple societies and organizations addressing issues in our healthcare workplaces, and violence is now becoming, for many, a predominant issue. What I've been finding, and I'll digress slightly, and doing this for several years, I've had talking to congressional aid for a variety of reasons. I've had people reach out to me and come and say, I want to get out of healthcare, or should I get out of healthcare? What are my options? And more recently, which led me to write this most recent article, I'm hearing from doctors, nurses, other healthcare professionals, and now this really rocked my world when I've had medical students reach out to me and say, I don't think I want to do this anymore. But violence is becoming evidently a tipping point where people tell me, well, they've put up with the other travails of our current healthcare workplace, but when they were assaulted, or their family member, their spouse was assaulted, who's also a healthcare worker, or their colleague, or they viewed it, all this seems to be, that's a bridge too far. I've had enough. I want to leave. And most recently, the thing that caused me to visit this again is I'm now having people at all levels tell me these are assault victims. When they go to try to their hospital, the district attorney's office are all telling them, we don't want you to do, the hospital doesn't want this, that's bad publicity. The DA's office has told several of the people I've talked to, why bother us with this? You know, we're stressed as it is. We've got lots of work to do. This is just a norm. You need to just get used to it. This is part of your workplace. I don't think that should be part of our workplace. As I look into it, I find, again, more and more doctors and nurses and other healthcare professionals are finding this. This is the straw that breaks my back. I can't do this. I don't feel safe. I want to find a safe career. How do I migrate and how do I move? When I started looking at some of the data and realizing how many people are leaving healthcare, doctors, nurses, and others, and that even now hospitals are closing, currently mostly rural, but increasingly into suburban and urban areas, because they can't reliably get enough or afford the doctors and nurses to keep their service lines open. So they're financially upside down. So this has a domino effect throughout our healthcare system, which means more and more patients are going to find they have little or no access to healthcare. So I think it's a critical problem. And I find that when our leaders have become calloused and are promoting the idea that you need to just get used to this, that's a serious problem that could, again, domino down to lack of healthcare for a huge number of our citizens.
Now, for context, what are some stories and examples of violence against healthcare workers that you're hearing about?
I had one couple that neither one of them have personally suffered violence. He's an emergency physician. She is a nurse working in the same, it's a big safety net referral hospital, but both of them have witnessed their colleagues suffering violence. In one case, an assailant with a knife. Fortunately, the knife was taken away from him. The nurses had multiple of her colleagues pushed, hit, shoved, knocked down. The thing that really tripped their trigger was she's now pregnant with their third child, and they have two other children, like I believe 1 and 3. So they both now fear each other going to work, telling me, what if my spouse doesn't come home? What if I get a call, they're in the ICU, or they've expired? So they both want the other to find another job. Another episode, nurse practitioner was walking down a hallway, came around a corner, and was blindsided, attacked by a patient who had, I guess, for whatever reason, out in the hallway trying to be stopped by various, I guess, security, but he attacked her in the process. She was hurt badly enough that she had to be admitted. She recovered physically, but is now undergoing counseling therapy and physical rehab. She tells me the hospital approached her. We will pay all your bills, all your counseling, but please sign this non-disclosure. We don't want you talking about this. This is, and she said they literally said to her, this is, quote, bad for business, end quote. Third episode, I've had a medical student recently approach me saying, I believe he's a third-year med student, but are there options for him to migrate into something else? And I asked, what's driving this process? And he said that, violence is something that the medical student group and the pre-med group where he's located, that's become a dominant topic in many of their discussions. And I said, oh, and he said, no, that's not the tipping point for me. He said his parents called him and asked him if he recently heard from, and I won't mention a name, but it's a person that this medical student knew since he grew up. It was a family down the street. This young man, the person down the street, was someone he had modeled himself. He had been very successful in high school, college, gone to medical school. Now I believe is residency or fellowship. And his parents asked him, did you hear what happened to, let's say, Jim? The medical student said no. And they said, well, Jim was in a room with a patient having to deliver some bad news, and the family assaulted him, and he had to be hospitalized for his injuries. And this young man, the medical student talking to me, basically this rocked his world. He had modeled his whole life after this. And he said, I'm going into healthcare to help people, and these very people are turning against us. I don't think I want to do this anymore. And that really caught me that first time I've had a medical student reach out and say, I want to change my career. And I went and looked to see, is there more? And I found an article published, I believe, by the AAMC that notes that 25% of current medical students are seriously thinking of not completing their medical education. And 61% of current medical and nursing students say in this study that they will finish their diploma, but they do not plan to manage or touch patients. They're going to go into administration, into research. Again, I think these are some frightening statistics about what the near future of our medical status may hold.
Now, when you tell me the story about that healthcare worker who was assaulted and a hospital made her sign a non-disclosure agreement because it's bad for business, is that an isolated incident? How common does that happen to your knowledge?
When I've looked and I've tried to review, I don't see a lot of publications that specifically target that. I did see an article with another physician who, as I mentioned, he was assaulted. The hospital tried to encourage him to don't pursue this. He wanted, resolution. He filed a complaint. The DA's office, again, I mentioned this earlier, said to him, why are you doing this? This is just part of your job these days. And I've now heard 3 or 4 incidences of people are reading about this. But I suspect in my society meetings that this is much more prevalent than we even see published at this point. So, and as I noted in the article I wrote for you, only 30% of all these events ever make it to any news media. So I suspect it's a much, much more prevalent problem than we're seeing. It's a tip of an iceberg.
And the stories that you said earlier about how legal authorities, district attorneys, saying that they can't handle more cases about healthcare workers being assaulted on a job. How common is that?
Again, I've got the reports of people coming to me and
Mm,
telling me that, but when I talk in my society groups, I get the sense that more and more of my colleagues are sensing that when they talk to their hospital leaders, politicians, legal people, that there is more of a sense of, I guess I'll use the word callousness,
mm.
that this is, why are you making a big deal out of this? This is just part of your job. I believe I noted in an article, I found one political leader um, in a visit to DC that basically told me, he said, doctors and nurses aren't tough enough. You need to be trained in toughness like I was in the Army. And again, sensing that, why are we making a big deal out of this? It's just part of our job. So again, I don't have exact statistics on how prevalent it is. I just suspect it's an evolving and becoming a more prevalent reality in our workplaces, unfortunately.
So you're saying that the evolving attitude among those in authority is that healthcare workers should expect to be assaulted at work.
Correct.
Now, for those who did speak out, I'm not sure what kind of stories that you know. Did they receive any pushback when healthcare workers told their stories in public about being assaulted?
That I don't know. I haven't heard them tell me that there was a negative response. There was resistance, as I said, through the system of trying to meet resolution, but no one has come and told me that they've received threats for speaking out as of yet. I'm hoping that's not going to occur, but I've got my fingers crossed.
I'm just speculating. If healthcare workers, for instance, refuse to sign non-disclosure agreements, would that put their job at jeopardy if they choose to speak out about something that happens in the workplace?
Yeah, I've not had a, I guess I'd use the word client come and say they've refused to sign the agreement. So yeah, I don't know yet.
So, from the healthcare worker perspective, what more can be done? How can they protect themselves against assaults in the workplace?
It's a difficult topic. Many states, and like I said, I speak to congressional leaders in DC and both in the state in which I clinically practice, Tennessee, and many states have now either already enacted or are in the process of acting harsher penalties for those who assault healthcare workers. And that's a step in the right direction, but one thing I feel is that many of these assaults are not planned events. Certainly in the state where I live, there was a physician who was shot and killed in his office, and that was a planned event. The assailant came in intending to do harm for what he felt was he had been wronged by that clinic. But many of these events are people who are having a bad day, and something overwhelms them, and it's not planned. Now, many of them may be carrying some type of weapon. So subconsciously, you could say maybe they've made some decision that I'm going to use that. I, in fact, we've had two cases incident, recently, of patients in the clinic where I work carrying handguns. They've shown them to me.
Hmm.
They had some illogical reasons why they have them, but it's when we have people with weapons and they're having a bad day, it's usually not going to lead to a good outcome. So does harsher penalties, putting them in jail for a long period, will that dissuade them from performing those events? I'm not so sure it will. So then we get down to, well, what are the standard prevention tactics? Security. We see in our airports, TSA, the metal detectors, inspections, people with guns, security officers, guns. But I hear from the hospital leaders, they don't want to do this.
Hmm.
Now, if they're all on the same playing field, if a federal agency says every hospital has to have metal detectors, armed security guards, then they said yes. But what I'm hearing, and I'm even talking to some of my local leaders, if one of the hospitals say in my community, were to less get highly secure about what standards might be, metal detectors, armed security guards, stuff like that, they perceive loss of market share. They perceive that patients and families see that as unfriendly. The hospital right down the street is not doing that, so they'll migrate to that less aggressive hospital. Again, these people tell me, well, if everybody's on the same playing field, we'll do what we need to do, but we want all hospitals to be participating. When I talk to Congress, what I'm hearing is many of our federal leaders and even state leaders do not want to increase federal bureaucracy. So they are not very eager for increasing federal laws that mandate hospitals, high security, all this kind of stuff. So now we're left in a quandary where the hospitals perceive themselves as in a bind. If they protect their workers, they lose market share because no one's stepping up and saying this is a new standard. And we have our federal leaders saying we don't want more bureaucracy. So it's very difficult. Are there some answers to this? Maybe. Interestingly, there's no research on any of this. There's no research that I can find in healthcare that says that the standard security items like metal detectors, armed security guards, does that have an effect on reducing violence in the healthcare workplace? We would assume it does, but that's not known. What about signage? What about putting up big signs warning if you attack a healthcare worker, you're going to jail? Again, that might affect those that are having a bad day and are thinking maybe I'll hit somebody, but we don't know. There's no research. One idea I had that I'm trying to start floating is, what about a whistleblower law? What about, we have whistleblower laws for those in any business and industry that see malfeasance going on, who can report this and be protected from retribution. What if, again, hospitals don't want workers to report violent episodes? What if there were, the states passed whistleblower laws that said that if a doctor, nurse, or the healthcare worker is assaulted by any manner, they are allowed to go report that and do not get any retribution from their employer? Would that be a way to level a playing field? I'm not sure, but it's something I want to try to start investigating. But like I said, right now, because of the reasons I mentioned, there are not a lot of easy answers to solve workplace violence at this point.
We're talking to Harry Severance. He's an emergency physician. Today's Kevin MD article is Leaders Advise Us to Accept It as a Job Norm, Violence Abuse in the Healthcare Workplace. Harry, let's end off with some of your take-home messages to the Kevin MD audience.
So my take-home messages would be, if we allow healthcare workplace violence to proceed, we become inured to it, become callous, and just say, this is part of your job. I think, as I'm starting to see the young, bright minds, the potential future doctors, nurses, mid-levels who are highly bright, highly adaptive, are simply going to say, I'm not going in healthcare. I'm going to seek an alternative, a safer career. Very logical. We also know there's already a huge shortfall in the numbers of doctors and nurses and mid-levels that we need. And we're getting into a huge population bubble with the baby boomers retiring and needing increased health care. So as more future doctors and nurses choose to not become doctors and nurses, this just further aggravates the situation. Jumping several leaps, my final thought, corollary would be, we hear the idea of Dr. AI or Nurse AI. And there's much, and probably reasonably so, resistance to that, though there are some studies that have shown in like telemedicine areas, Dr. AI is perceived these are small studies with only a few hundred participants, but Dr. AI was seen as being more empathetic and providing better answers than the live physician on the phone. Taking that several leaps, What if in the near future, especially in our rural areas, we find that whole areas of states have little or no human health care? Does Dr. AI then become a more acceptable alternative, and will state governments start to turn to Dr. AI, especially in areas like telemedicine, when it's a choice of no doctor or AI doctor? And again, waxing science fiction, becoming reality, could that be an area, if we find ourselves in even the next 5 or 10 years, if we don't aggressively address these healthcare violence problems, which right now it seems some of our leaders don't want to do?
Harry, thank you so much again for coming on the show and sharing your time and insight.
Thank you, sir.